I'm going to talk today about a question we got on our blog, and that was, can orthotics be used to treat hip pain? And with this, I want to talk about an interesting patient I had. So I actually had a very similar problem just a few months ago. A patient came in who'd had actually quite a few years of hip pain, and he had a full workup. There was no evidence of any arthritis or anything else actually wrong with the hip. So the question was, could his foot mechanics be playing a role in that? And there's actually not a lot of literature out there. There hasn't been a lot of research looking at the relationship between foot mechanics and hip pain. There are a couple studies that would indicate there can be a relationship. And in those situations, it appears that the most common cause of this is overpronation. So pronation is the act of the foot rolling in. Some people pronate too much. The foot continues to roll in. Let me show you that from the back. Here's the foot rolling in. But when the foot rolls in, the leg will rotate to the inside. So as the leg rotates to the inside, the knee, the hip, and even the back also roll in. So that can put abnormal stress on all of those structures. So this patient came in, and first thing we did was we put a taping on his foot to support it and let him go out and wear that for a day or so. We found that almost immediately he found that the pain went away. So we ended up making him an orthotic device, and what we did with the orthotic was to get one that conformed very, very close to the arch of the foot to stop the arch from going down. And then because his heel was rolling in a lot, we made a fairly deep cup on the back of the orthotic, and we put a wedge in it to work on the heel here to stop it from rolling in. And what all of that does, not only does it stop the foot from going in, but it stops the leg from rotating to the inside. So that takes stress off the hip and the knee and the back. And in the situation of this particular patient, within 2 weeks of wearing his orthotics, he had 100% relief of the hip pain he'd been living with for several years. So the answer is yes. In many cases, it can be an effective way to treat the problem. Certainly not on everyone. There are a lot of causes of hip pain, and not everyone by any means has that caused by their foot function. But if everything else has been ruled out, find a podiatrist who specializes in orthotics, go see them, and they can often provide you with something that's going to give you a lot of relief. If you want more information, do a search on our website for orthotics for hip pain or just for hip pain, and you'll find all kinds of information there.